Hi, I am April Meyer, and I am from the Mankato campus. After listening to this presentation, you will be able to understand the signs and symptoms, warning signs, effects in the body's systems, treatment and prevention of panic disorder. Approximately 29% of the United States human race has suffered from anxiety disorders during their lives. Signs and symptoms can develop quickly and reach their highest point within 10 minutes and can last 20 to 30 minutes. They can be caused from environmental stimulants like trauma and stress, genetics, and phobic disorders. Phobic disorders are the leading cause of panic disorder because often the individual fears the next attack. Studies have found that there are early warning signs and symptoms, and they can start as much as an hour before the attack and may be the cause of making a person panic. These early warning signs are shortness of breath, heart palpitations, and chest pain. Many people don't even realize these early signs are the beginning of a panic attack. Those 3 early warning signs may cause the person to become afraid, and they may start to feel the following symptoms: hyperventilation, sweating, nausea, dizziness, hot or cold flashes, and they may start to feel detached from their surroundings. There are also psychological symptoms, for example, feelings like they may die or are going crazy, and numbness and tingling sensations throughout their body. Almost every body system is affected by panic disorder. The first one we will talk about is the digestive system. The digestive system will slow down or stop so more blood flow can be directed to the brain and muscles for energy to protect itself. This will cause dry mouth, and many of the organs in the system are affected also. The stomach will cause stomach ulcers, nausea, and diarrhea. The gallbladder will twist, which is also known as torsion. Due to the increased blood pressure, the liver gets stressed, and this can lead to liver disease. And the pancreas can develop into pancreatitis, which is inflammation of the pancreas. Homeostasis is disrupted tremendously in our endocrine system. This causes a lot of stress in our cells. When the endocrine system is affected by panic disorder, the metabolism will slow down over time, which will raise blood glucose levels in the brain and can cause fat deposits to grow in the belly area of our body. Protein synthesis is also prevented with panic disorder over time. Our immune system is greatly compromised due to the hormone cortisol that is released into the body during a panic attack. This will make the person much more susceptible to illness. The muscular system is working overtime, trying to push blood through to areas in greater need. This will prepare the muscles in the body for action to protect the body and move more quickly, which in turn causes muscle tension and muscle strains. The skin will turn a pink or bluish color due to muscle tension. Organs will start to show structural damage because they will no longer have what they need to defend themselves. The integumentary system will show signs of hair loss, acne, premature aging, and possible infections due to the skin being attacked. Libido is affected within the reproductive system, causing impotence and infertility. The lack of homeostasis damages the urinary system. The body's temperature is not regulated properly, which can cause bladder and kidney infections. The lymphatic system is affected when the spleen discharges white and red blood cells to allow the blood to send more oxygen to our vital organs. Lungs work overtime in our circulatory system due to the increased breathing rate. This supplies more oxygen to the blood for muscles to tense, which we discussed in the muscular section. This also removes too much carbon dioxide. When the body loses too much carbon dioxide, this can cause hyperventilation. The body sees this as dangerous and secretes adrenaline, which will help prepare the body for attack. Hyperventilation causes shortness of breath and dizziness. Adrenaline will make the individual feel jittery and will also rise the blood pressure, enlarge the pupils in the eyes, and expand the lung passages. The heart in the cardiovascular system will quickly pump blood to the areas the body needs it the most, like our vital organs. The symptoms for this may include dizziness or lightheadedness, shortness of breath and fainting, heart palpitations, and chest pain. The parts of the cardiovascular system affected are the heart, blood, and blood vessels. The nervous system is affected the most. It goes on red alert and takes the input it receives from the internal or external environment, sends this input to the brain. The brain then processes this input, and the body will respond by telling the system what to do. Red alert symptoms are sweating, chills, and hot flashes, exhaustion, the inability to concentrate, insomnia, dizziness, fear, and flight or fight actions. The release of adrenaline causes many of the short-term effects on panic disorder. These symptoms include increased breathing and heart rate, temporary immune system boost, discomfort, lightheadedness, upset stomach, bloating, headaches, and muscle tension. Long-term effects occur when the individual has been experiencing panic attacks over time. Eventually, the body won't get the signal to return to normal and can cause weakened immune system, vomiting, diarrhea or constipation, loss of appetite, lack of interest in sex, insomnia, overall increased anxiety due to the fear of panic disorder, clinical depression, high blood pressure, heart disease, and diabetes. There are currently 2 treatments for panic disorder: therapy and medication. Therapy can be used alone or with medication. The 2 types of therapy that physicians usually use are psychotherapy and cognitive behavioral therapy. Psychotherapy teaches the patient how to understand panic disorder and how to manage it. The doctor will recreate a panic attack in a safe environment. When using cognitive behavioral therapy, this will show the patient that the panic they are experiencing is not dangerous. Some patients even find relief from panic disorder symptoms in just a few months. There are 3 different types of medication that physicians use to treat panic disorder patients. The first choice of medication used is selective serotonin reuptake inhibitors, also known as SSRIs. These are generally safe with a low risk of side effects. The second choice is serotonin and norepinephrine reuptake inhibitors, also known as SNRIs. They are an antidepressant that can help slow symptoms of panic disorder. Finally, benzodiazepine, which are sedatives that will depress the central nervous system. They are habit-forming and used to stop a panic attack while the patient is experiencing it. They also have very dangerous side effects. There is a method that physicians teach patients to help regain control of a panic attack. This method is also called AWARE, A meaning accept the anxiety, fighting it only makes it worse, W meaning wait, take a minute to concentrate and think, A meaning action, work on your breathing from your belly, R meaning repeat these steps until the panic has stopped, and finally E, end, panic attacks do end. Remind yourself of that. There is no sure way to prevent PD, but there are things one can do to prevent it. To try to prevent it, early intervention is the most important to prevent panic disorder from becoming, especially for young adults. Early signs of anxiety can be treated and can help prevent PD by seeing a therapist to treat the first signs of mental illness. Another way is stress reduction. Stress is a proven to cause anxiety and panic in some individuals. Learning how to cope with it can slow or stop panic and eventually panic disorder. This can be accomplished by exercising, taking breaks from your normal routine, avoid sugary, greasy, processed foods, keep a journal, and definitely avoid caffeine, alcohol, and nicotine. I hope you enjoyed this presentation and how to learn to properly diagnose and treat PD by learning the signs and symptoms and treatment options. Have a great day.